Alright, hi everyone, this is Julie. Long time no talk, I know, but I have a whole long story to tell you guys. Oh no, Ben has the hiccups. See, here's little Ben. Yeah. Anyway, so, let's see. I think today's Tuesday, so that would mean that this is Ben's 4th week. So, or his 4th Tuesday anyways. He will be officially 1 month old on July 5th, so that's in 3 days, because today's the 2nd. But anyway, this is going to be my labor and delivery story. I'm going to try to make it kind of short because it actually is kind of long, but I'm going to try and cut it down. But anyway, so here it goes. On June 4th, I went to the hospital at 9 p.m. to be induced. So I get there, I check in, and about 15 minutes later, you know, I'm in my room and everything, and I go into the bathroom to change into the gown and whatever. And I go in there, because right before I had left, I had taken a shower and everything, all my clothes were fresh, clean, whatever. Anyway, so I go into the bathroom and I look into my underwear and I notice that it's wet. And I know that I didn't pee myself, and I don't think it was sweat or water or anything like that, or actual drinking water. But I did think that my water had broke then and just was like doing a slow leak or something. And so I called the nurse, and she had the little paper strip thing, and she pressed it into my underwear to try and test the fluid on it, and she wasn't getting a positive result or whatever, but I still thought that that's what it was. So anyways, so there was that. So I'd say probably around 9:30 I was actually hooked up to the monitors and stuff after she asked me more questions about allergies and all that kind of stuff. Anyway, she put me on the monitors, and then also at the same time I had an IV going, and the other nurse, there was one nurse doing the IV and then another nurse doing the questions or whatever. She put it in my right wrist on the side because I have like a bulging vein there, and it hurt so bad every time I would bend my wrist, but she wouldn't try any other vein. So that's what it was in, and it was horrible. But anyways, so at first Ben's heart rate was really difficult to find, and when they finally did find it, it was varying a lot. Sometimes it'd be really high, like 180, 190, whatever, and other times it would dip kind of low, around 80 or whatever. So it started off being really erratic and stuff like that. Yeah, so around I don't know, I'd say 10, I'm trying to write stuff down, but I would say around 10:30 or 11, she was readjusting the monitors, and at that point I was asking her if I could get up to go to the bathroom again, and she was showing me how to unplug myself from the monitors and be able to plug them back in when I got back in bed after I went to the bathroom. But I was 100% sure that it broke while she was explaining that, because all of a sudden there was a huge gush. It was more like a squirting kind of thing, actually. That's what it felt like anyways. And I just had this crazy look on my face, apparently, like, you know. And so the nurse, well, I got up, and then the nurse looked at the things they have underneath you, the pads under there, and there was this brownish fluid on there. I know I didn't pee, I know I didn't crap, I didn't do any of that. You know, and she had a couple more of the little strip things, and she had a positive test for amniotic fluid on one, and another one was negative. And so that was really weird. But anyway, and they had me going a lot on the saline because I was apparently dehydrated. So they had the saline drip going really fast instead of slow. So Anyway, so I go to the bathroom and get back in bed, and a few minutes later I get my first dose of Cytotec, and it took so long because I got there at 9 p.m. and it took so long for me to be able to get the induction medicine because of Ben's heart rate being all over the place. And when I forgot to mention, when I got there, I was still 1 centimeter dilated, and I was barely effaced at all. So, anyways, after about 20 minutes or so, the Cytotec was giving me some really strong back contractions, and they were pretty close together. They started out being, excuse me, maybe a minute 30 to a minute apart, and lasting maybe about 30 seconds or so, but they just progressively kept getting longer and longer. But the Cytotec, it does kind of wear off after a while. And anyway, so probably less than an hour after going to the bathroom the first time, so I'd say getting close to midnight, I had to get up to go to the bathroom again, and I stood up and I started walking to the bathroom, and there was just a giant mess all over the floor. And my husband was like, "Oh my God, gross." And so I called the nurse back in and I said, "Look, I am not peeing myself. Like, that is for sure a test. I want you to test it again." You know, and she was like, "Well, let me just call this other nurse in." And so she calls a nurse in who's in training to be a nurse practitioner, and she looks at it and she goes, "Yeah, that's her amniotic fluid." And she tested it in a couple different spots, not just, you know, one sample. She tested it, you know, several times, and she was like, "Yeah, this is most definitely it." And she said it has meconium in it, which is why it's brown, and it has particulates in it. Because while I was sitting on the toilet going to the bathroom, more and more of this fluid just kept coming out. Sorry, Ben's slipping. So that kind of freaked me out because, oh, great, you know, he has meconium and it has particulates floating in it. Not is it just meconium tinted, but there's particulates in it. That's awesome. And so, yeah, but I kind of suspected that there might be because I was 41 weeks pregnant, so whatever. But anyways, so I get back in bed and all that stuff. At about 2 o'clock in the morning, I got my second dose of Cytotec, and they also checked me then, and then I was dilated to 2 centimeters, and I'm not sure how effaced I was. And so again, the contractions really strong, pretty much all in my back. Around 3:30 in the morning, I asked to get some kind of pain medication, and they gave me something called Nubane. As soon as they injected it in there, I felt really out of it. It was kind of a weird feeling because I had never taken anything stronger than a Vicodin before. So yeah. So shortly after that too, I fell asleep, and I woke up probably close to 6 o'clock in the morning, and they checked me again, and I'm not sure if I had dilated anymore. I think I was effaced at least 50% then, I want to say, but that is when they started the Pitocin. Yeah, so after the Pitocin was started, I requested to get an epidural because I was told that because it was so early in the morning, the anesthesiologist might not even get there until maybe 8 or 9 o'clock in the morning. So I decided to go ahead and request it then because the contractions were pretty much all in my back, and even though I know I was being a pain to the nurses, you know, I was getting out of bed, I was trying to kind of walk around my room, still being connected to these monitors, and I sat in my rocking chair I had in my room. Oops, and I just like rocked for a while, and it just, the pain was not getting any better for me. So yeah, so I requested an epidural, and I'd say it took about 45 minutes to an hour for me to have the anesthesiologist come in. So I'd say it was around 7:15 to 7:30-ish when I got one. and I wasn't going to oppose to it at all. And I know I was less than 4 centimeters dilated, because I remember asking, well, don't I have to be at least 4 centimeters to be dilated? And they said, yes, at least 4 centimeters or until your membranes rupture. And so since my membranes had been ruptured since probably around 9, but it didn't officially count until almost midnight, I guess. But anyway, so in my hospital, they don't give you a Foley catheter when you get an epidural because of a higher risk of infection and stuff. So every 2 hours, the nurse would come in and they would straight cath me every 2 hours. And I didn't realize how much urine I had like stuck in my bladder from where Ben was sitting at, that I could not pee out. Because when they changed shifts and everything and stuff, they started actually pushing on my bladder, and of course I had the epidural at this point, so it didn't hurt at all. The straight cathing didn't hurt at all. I couldn't feel it with the epidural. But they were pushing on my bladder and so much urine was coming out. It was crazy. But anyways, so pretty much all day, my progress was very, very slow. Probably by 3 o'clock in the afternoon, I was only dilated to 4 centimeters, and I had been on Pitocin all day. So my progress was not very fast at all. And I'd say like around 4 o'clock p.m. The nurse came in, because they tried to put me in different positions to get Ben to maybe be in a little bit more of a favorable spot to try to make me progress more and stuff. But then around 4 o'clock the nurse told me that his head was starting to cone on the side of his head instead of on the top. So his head was down and like twisted the wrong position and stuff. And then they called my doctor in, and she came in, my doctor checked me, and she said, yeah, he is coning on his side, on the side of his head instead of on the top, so he must be turned the wrong way and stuff. And at that point, I had been 4 centimeters earlier, but she said I had reverted back to only about 3.5 centimeters. But I was fully effaced at that point though. And then my doctor just said that his head is just going to be too big coming down that way for my birth canal or whatever. And then her and some of the nurses went out of the room for a while to talk. And so they told me that they want me to have an emergency C-section, because if he goes down anymore, he's just going to become stuck in my birth canal, and that's going to be really bad. So they told me that maybe around 4:45, and they told me my C-section was scheduled for 5:15. Bless you. So, bless you. Bless you. So while I was sitting there, oh, you're so cute. So as I was more like laying there, waiting, I was trying to call, you know, my sister, my sister-in-law, my in-laws, like, you know, my most important people or whatever, because my mom had been there with me since probably around 6:30, 7 o'clock in the morning, and obviously my husband was there already. So so I called some people, and I ended up going into the emergency room, operating room, probably around, like, I don't know, just before 5 o'clock, I want to say, maybe 4:50 or something. So I only had like 5 minutes to call people. Anyway, so I go in there, and the anesthesiologist adds the spinal block to my epidural, and they put me on the table, they strap me down, and while you're being prepped for your C-section, you aren't allowed to have your partner in there with you. And that sucked because I was terrified. And pretty much as soon as they added the spinal block to my epidural, I started to shake like uncontrollably bad. And on top of it, it was cold in the emergency operating room, because it has to be, I know that. But it was really, really cold, and I was scared, of course, to have an emergency C-section, because it was not in my plan at all. And there was meconium in my amniotic fluid, so I just, pretty much everything had just built up, and I just was crying, and I was shaking like this. And so, you know, they do strap you to the table, which is not fun, but anyway. So after a while, my husband comes in, and just seeing me like that, he started to kind of tear up a little bit, and so he got to sit on the stool next to me and kind of watch what they were doing. He did not get to cut the umbilical cord, which I was pretty upset about, but in another way I understood, because the meconium was so bad they needed to suction Ben out really well through his nose and throat and stuff, obviously. But he was pulled out at 5:12 p.m. Oh, excuse me. And he didn't cry right away. Obviously, he had to be suctioned. And but when he started to cry, I just bawled. And because normally when they pull the baby out, they hold him up above your little screen, but they didn't do that because they had to suction him out. But he started to cry, and they took him somewhere, and then I saw him being wiped off and whatever in this little bassinet thing, and you know, he was screaming his head off and stuff, and I just cried. And I just was so happy that he was okay, and that he was here. Like, it was almost unreal. But I just was so happy that everything ended up being okay, you know, with the meconium and with his head being like stuck in my birth canal, basically. I was so happy, and every time I think about it, I almost want to cry, just for a few different reasons. I was so upset though that you know, I didn't get to have him down on my chest right away, and all that. I was really upset, but you know, at the end I was happy though that that he was safe and he was healthy. You know, his APGAR scores both times at like 1 minute and 5 minutes or whenever they do it was 9, so he was really good. Oh, excuse you. But yeah, he weighed 7 pounds 15 ounces, and he was 20.5 inches long, and his head was 14 and something inches around, or whatever. So yeah, he was my perfect little angel. And so after they got done sewing me up, they took us into the post-op recovery room, at which time I cried some more, and they tested Ben's blood sugar, and it was really low, though it was only 28. So and my blood pressure, they tested his blood sugar, and it was 28, and they tested, they kept monitoring my blood pressure, and it was getting dangerously low, probably from a reaction to the anesthetic and stuff. So they had to lay me flat. I could not sit up at all, or they said I was going to pass out. But so the nurse and my husband helped put him on my boob to feed him, and so he fed for, I don't know, 5-10 minutes. I don't know. I passed out laying flat down still, but I would like wake up every once in a while, and he was feeding, you know, and that was my first time, I guess you could say, kind of holding him, with them helping him latch on and stuff in the biological nursing position, like the fall straight back on your chest thing. But anyway, so after they tested his blood sugar again, after he had some colostrum, it went up to, I want to say maybe 70 or something, so it was back to normal. You hiccup boy. But anyway, so the nurse was joking, like, you have straight cream or something, which is crazy because I didn't really get to eat much at all. I mean, I had Jello once and like one popsicle or something and some water. I think that's about it. But so anyways, that is my labor and delivery story. I have a whole nother video I need to do later on, because after he was about 2.5 weeks old. I don't remember the date. It was the 24th, I want to say. I had to go into the emergency room again, not related to his birth or whatever. I had a really bad gallbladder attack, just like when I was pregnant, except it was way worse. And so the doctor in the emergency room, well, actually he was a physician's assistant, but they're practically doctors anyways. So they ordered an ultrasound. They actually saw the gallstones. I had to have those out, or had to have the surgery the next day. So I had my gallbladder out, stayed another night, went home, woke up the next morning and was yellow. So I had jaundice really bad. And so then I called the surgeon, went down to their lab, got blood work done. There's 2 different liver profile things they do when you're jaundice. One of them, the high end of normal, is like 37 or something like that, and my level was in the 500s. And the other one, the high level normal, is in the 60s, and mine was 700 and something. So it was really, really bad. I was really yellow. So they basically said, you need to get to the hospital right now. So I went to the hospital again, and I got more fluids and a lot of antibiotics, and the next day they scheduled me for an ERCP, which is a type of endoscopy, and because they thought that I had a gallbladder obstruction or a gallstone obstruction in one of the ducts by the liver. I can't remember which duct. But when they actually did the endoscopy, the stone probably had already gone away by that point, so there wasn't anything there to find. So, and then I stayed another night, and then I got to go home, and now things have been fine, just trying to settle back into being normal. I go in to the surgeon again on the 5th for a checkup, and for the gallbladder surgery. And I want to say the 6th is my next post-op or post-C-section, postnatal, whatever you want to call it, appointment with my OBGYN, and I think they're just going to check my C-section and whatever. But at this point I am still bleeding. It has slowed down significantly like about a week ago, but just in the last 2 days the bleeding has really started to pick up, where the bleeding is now like red instead of like that darkish color and whatever. But anyway, so that is my labor and delivery story, plus a little bit about my gallbladder surgical drama, I guess you could say. So I don't know how my battery is doing or how long this video is, but I just wanted to let you guys know how we were doing. We are doing well. I think Ben has a dirty diaper right now, so he needs to be changed. But here's my precious blue-eyed boy. I love him with all my heart. He's still a pretty good sleeper at night. Sometimes during the day he can be a little terror in staying up pretty much for 3, 4, 5 hours at a time, and he gets so tired that he just cries. But you know, he gets fed whenever he wants it, basically, which seems to be more and more lately. So maybe he's getting ready for a growth spurt. But today he's been a good boy, and yesterday was worse than the day before, but I don't know. But anyway, there it is. You guys will hear from me again soon, hopefully, for Ben's 1-month update, and I will do an update on myself then as well. So I will talk to you guys again soon. Bye! Bye, Ben.